Hello beautiful moms two hearts. Welcome back to the channel, and if you're new here, I'm so glad you found us. This space is especially for you, for tired moms, new moms, first-time moms, and every mother who is doing her best every single day. Please know this from the start, you are doing an amazing job, even on the days when it doesn't feel like it. Today's topic is something very important but often not talked about enough: nipple care for breastfeeding moms. If you're breastfeeding right now, planning to breastfeed, or pumping milk, this video is for you. Many moms experience soreness, cracks, dryness, or discomfort in their nipples, especially in the early days of breastfeeding. And I want you to know, you are not alone, and help is available. Let's talk about nipple care in a gentle, simple, and supportive way, just like a mom-to-mom conversation. Breastfeeding is a beautiful and natural process, but that doesn't mean it's always easy. Your nipples are doing a lot of work, feeding your baby, adjusting to frequent feeding, and sometimes dealing with poor latch, pumping, or friction. It's completely normal to feel some tenderness in the beginning, but pain, bleeding, or cracked nipples are signs that your nipples need care and attention. The good news is that with the right care, most nipple problems can heal quickly and breastfeeding can become much more comfortable. Understanding normal versus not so normal nipple pain. In the first few days after delivery, mild tenderness or sensitivity can be normal as your body adjusts. But severe pain, cracks, bleeding, blisters, or sharp pain during feeds are not something you should ignore. If breastfeeding hurts every time, it's usually a sign of poor latch, incorrect breastfeeding position, dry or damaged skin, too much pumping pressure, infection like thrush or mastitis. Taking care of your nipples early can prevent bigger problems later. The importance of a good latch. One of the biggest causes of sore nipples is an improper latch. When your baby is not latched correctly, your nipple takes unnecessary pressure. A good latch means baby's mouth is wide open. More of the areola dark area is inside the baby's mouth, not just the nipple. Baby's lips are flanged outward. You feel pulling or tugging, not sharp pain. If latching hurts beyond the first few seconds, gently break the latch and try again. Don't feel bad, learning takes time for both mom and baby. If possible, consult a lactation consultant or experienced healthcare provider. Sometimes one small adjustment makes a big difference. Keep nipples clean, but don't overwash. Cleanliness is important, but overwashing can dry out your nipples. Here's what works best. Wash breasts gently with warm water during your regular bath. Avoid harsh soaps, body washes, or antiseptics on nipples. Pat dry gently, don't rub. Your nipples don't need special cleaning before every feed. Breast milk itself has natural antibacterial properties. Breast milk, nature's best nipple healer. One of the simplest and most effective nipple care tips is using your own breast milk. After each feeding, express a few drops of breast milk. Gently spread it over your nipple and areola. Let it air dry. Breast milk helps soothe, heal, and protect the skin. It's free, natural, and always available. Air is your friend. Allowing nipples to air dry helps healing. Whenever possible, leave your nipples uncovered for a few minutes after feeds. Avoid tight bras immediately after breastfeeding. Change wet nursing pads quickly. Moist, warm environments can lead to irritation and infection, so keeping nipples dry is very important. Choosing the right bra and nursing pads. Your bra choice matters more than you think. Choose soft, breathable cotton bras. Proper size, not too tight. No rough seams rubbing against nipples. For nursing pads, change them often if they become wet. Choose breathable, absorbent pads. Avoid plastic-backed pads if you're prone to irritation. Dry nipples heal faster. Using nipple creams and ointments safely. If your nipples are cracked, sore, or very dry, nipple creams can help. Look for medical-grade lanolin, natural nipple balm safe for breastfeeding. Products labeled, no need to wash off before feeding. Apply a thin layer after feeds. Avoid products with strong fragrances, alcohol, or harsh chemicals. Always follow instructions, and if irritation worsens, stop using the product and consult a healthcare professional. Pumping moms, extra nipple care tips. If you're pumping, make sure flange size fits properly. Avoid high suction levels. Apply a little breast milk or nipple-safe lubricant before pumping. Incorrect flange size or strong suction can cause nipple damage, even if you're not breastfeeding directly. Healing cracked or bleeding nipples. If you notice cracks or bleeding, continue breastfeeding if possible, it's usually safe. Focus on improving latch. Apply breast milk or lanolin regularly. Keep nipples clean and dry. If pain is severe, bleeding continues, or you see signs of infection like redness, swelling, fever, or burning pain, please seek medical advice immediately. Watch out for thrush or infection. Symptoms of nipple thrush may include sharp or burning pain during or after feeds, shiny, flaky, or itchy nipples. Baby may have white patches in mouth. Thrush requires medical treatment for both mom and baby, so don't ignore symptoms. Be kind to yourself, mama. Nipple pain can be emotionally exhausting. It's okay to feel frustrated, tired, or overwhelmed. Breastfeeding is a learning journey, not a test of strength or love. Remember, pain does not mean failure. Asking for help is strength. Every drop of breast milk you give matters. Your comfort matters just as much as your baby's feeding. When to get help? Please reach out to a doctor, midwife, or lactation consultant if pain continues beyond a few days. Nipples are bleeding or infected. Breastfeeding feels unbearable. You feel anxious or discouraged. You deserve support. Final words of encouragement. Mama, your body is doing something incredible. Nipple care is not selfish, it's essential. Healthy nipples make breastfeeding easier, more comfortable, and more joyful. Take it one day at a time. Be gentle with yourself. You are learning, your baby is learning, and together you will find your rhythm. If you found this video helpful, please like this video thumbs up. Comment below if you've experienced nipple soreness, your story may help another mom. And don't forget to subscribe to the channel for more supportive breastfeeding and motherhood content. 2 hearts.